Good morning, Dr. Seitz. I had a few questions about the current coronavirus and some of the mitigation efforts that are being undertaken and the reports you're seeing in the news. And just based on some of the conversations we've had, what do you think, or where do you think is the shortcoming in the social distancing efforts?
The social distancing has a major flaw in it. So let me try and illustrate that. I think it's best illustrated on the board. So the general idea, seen from top down, let's say that's a Home Depot or a Lowe's, and here's the checkout counter. They have basically put markings down on the concrete so that people are 6 feet apart. Because the thinking is that if somebody sneezes or coughs, that droplets will spray 6 feet. And so if we keep that distance, everything will be good. However, what this idea implicitly denies or doesn't take account of is that if somebody even just clears their throat or is talking or has a dry cough, remember that the coronavirus is not like the common cold. You haven't got tons of tissues and blowing your nose all the time. It's a dry process. So when you cough or clear your throat or talk or even just breathe, you are expelling all the time these viruses in aerosols. These are fine droplets, James. They're not individual viruses. They are small droplets that float around in the air around you. They're invisible, but they're right there. So now imagine there's somebody standing in this position waiting to pay over here. And they, just before they walk off, they talk to their child. Maybe they're infected, didn't even know about it. They talk to their child, clear their throat, and viruses, aerosols are expelled. And they are floating now in this area where that person was standing. They're literally floating. It's as though somebody was smoking a cigarette in that point, and their cigarette smoke was floating there. Great. Now this person moves forward to pay. And the person that was standing over here moves into their position. Think about that. Somebody has been breathing for a few seconds, for a few minutes maybe even, into this airspace. There's no air ventilation at all. They are expelling these aerosols. Then they move forward, and you step from your safe space 6 feet away into that point where that person was standing. And now you're breathing in all that air that they had been breathing out. Which is why social distancing really doesn't work at checkout counters or where you're sitting in a waiting room, because it stays in the air, the person moves, you go into that space. So if anything, this idea of social distancing in checkout lines causes a bigger problem. You are guaranteeing, in effect, that the person behind you is going to step exactly into the spot where you were. And if you were infected, and you left aerosols behind, you will spread the illness. Does that make sense?
Does make sense. It's a good ideal, but surely social distancing has worked. I mean, the curve has flattened. So how do you respond to that?
That's a very interesting thing. So let's go back to the Spanish flu, 100 years ago. Okay, so what happened in the Spanish flu? You can Google this. You can go on Wikipedia. How did the curve look? It went up and down, flattened, and then really went up and down. There was no social distancing there. These were seasonal points. In fact, the first peak, which is very similar to what we have with coronavirus, occurred in the latter half of the winter season. Flu season, cold season. This naturally plateaus as we move into the spring and goes into the eye of the storm. This period is a naturally occurring period for these type of influenzas and colds. So the question now is, did social distancing create this valley? Or was that to be expected regardless? In other words, is this valley that we are now experiencing with coronavirus being driven by social distancing and staying at home, or is it just a natural seasonal drop-off? It's not necessarily true that social distancing is the cause of us, as we come out of our winter into our summer, that the rates and everything are coming down. We are sitting here. Same thing happened for the Spanish flu and all these other influenzas. The terrible possibility is what we see over here.
Interesting. But social distancing on some level does make sense. I mean, you used to call it personal space, I guess. But what are your ideas on how we should make social distancing more effective, I guess?
Okay, so yes, absolutely. So social distancing, or 6 feet apart, is half of the solution. So here we have a person standing, and here we have another person standing 6 feet apart, maybe in a checkout line. And this person, unfortunately, this is them here, happy still, but infected, they are taking aerosols out. They are breathing out aerosols. These are these little dots over here, and they are real. It's not imagination. They are the aerosols, and those red dots are the infected aerosols. So the only thing that we can really do if we want to have this person walk forward into that position is that we have to introduce fresh air, clean, filtered air from the top. Clean, fresh air needs to come in from the top, and there has to be a suction point below. It could be under a counter, it could be next to the person, or the perimeter of the space. So this is where the air gets sucked down and out of the room, and then cleaned before it's being returned at the top of the room. So what you need to do is continuously be pushing the aerosols down towards the floor, so that by the time this person walks forward, these aerosols are maybe at waist level. They've moved down. Now you're not going to breathe them in quite as readily. They're not so concentrated at mouth level because you've brought fresh air down. It's the same thing like opening the window when there's a stuffy room, or maybe you've burnt the toast, you open the windows, you let that smell out. So in every checkout area, there should be air that comes in from the roof level, which is clean, fresh, down and out through the floor. So that as these people are moving, you clean the air, that they're not breathing in all those aerosols. That's the only way, with a combination of social distancing and downflow, that we can make this kind of area in our stores, in our pharmacies, safe. The only way.
Wow. That really does make a lot of sense. So with that in mind, what are some areas you recommend as being key to practicing this method? Okay,
so obviously I've spoken a lot about checkout lines. There should, in my opinion, there should be no lineup that doesn't have downflow. So supermarkets, pharmacies, anywhere where you'd line up, pay for goods, keep the 6 foot spacing, absolutely. Downflow, as the first person moves forward, wait a few seconds, then move forward. Allow time for the air to clear around that person. So I would say checkout counters. The second big area are waiting rooms. Waiting rooms. So imagine you're going to the optometrist, you're going to see a doctor, maybe you're just in a general waiting room at an office. You could be there with a driver, with your kids, whatever. Those waiting rooms are very dangerous. So here people are sitting in chairs. The doctor calls the patient in. The patient goes in, the chair is vacated, a new person walks into the room, sits down. So waiting rooms are critical. Churches are critical. Any area where people gather and may move from place to place. Very, very important. Because remember, James, somebody's sitting in still air, breathing out. They move to a new place. You unwittingly go into that area. You are breathing in all that air that they breathed out. It's extremely dangerous. There's no ventilation.
Wow. A lot to think about, digest, Dr. Seitz. Well, thank you for taking time to discuss this with us.
You're welcome, James.